Why do we always blame our genes on our health, or that my parents had arthritis or diabetes or heart disease or whatever the problem is? Why is it so common for us to blame bad luck or our genes? Well, the interesting thing is it takes all responsibility away from ourselves. When we can blame something like our genes, it means that we can take the responsibility and pass it on to something that isn't within our control. But when you really think about it, what are the main causes of disease and dysfunction? Because ironically, if we look at our health in society nowadays, it has changed dramatically and become significantly worse. The number of cases of cancer, diabetes, heart disease, etc. are through the roof, but our genes are exactly the same as what they were millions of years ago. Our genes have not changed that much, yet our health expression has changed dramatically. So we're becoming less healthy, spending more money on healthcare, and becoming less healthy as a consequence. So is it really our genes that are the problem? Now, when we break down disease and we look at dysfunction and disease, it can be pretty much broken down to these three main areas that I almost always find that most practices are not talking about: physical stress on the body, chemical stress on the body, and emotional stress on the body. And they can be of one of two things. You can either be toxic in those areas, e.g., I fell down the stairs, that would be considered a toxicity in physical, or I might not be moving enough, which would be a deficiency in that area. In the same sense, we can look at chemical stuff. We can have too much of a vitamin and we can have too little of a vitamin. And again, with emotional, last year was a killer for this one because we could have had too little human contact, or in certain cases, we could have too much financial stress. All of these things would cause a change, and ironically, these cause a change in the expression of our DNA. And if you want to learn a little bit more about this, there's a brilliant guy, his name was Bruce Lipton. He's still around, he's still kicking around, doing some amazing research in something called epigenetics, which is how our body will adapt and how our genes and our cells adapt and express health differently based on the environment that we put ourselves in. So always note that it's not always bad luck. It's not always bad luck, that we can take control by making sure we're keeping an adequate volume of exercise, making sure we're taking care of our mental health, and really taking care of the things that we put into or breathe into or surround our body with as far as the chemicals are concerned, so that we can ensure that we can actually stay as healthy as we possibly can. Just some thought, if we're spending millions and trillions of dollars on healthcare and we're not getting any healthier, maybe we need to rethink the problem. Patrick here from Complete Health. This is your Daily Dose. I'll speak to you again soon. Take care for now.